Hello everyone, Dr. Ray Benedetto here again today with another short video. Today we're going to talk about a very popular drug that's used for a condition that's starting to run rampant in the United States, in all honesty, type 2 diabetes, right? So no doubt many of you watching this or listening to this, seeing this on video, know someone who has diabetes or blood sugar problems, type 2 diabetes especially, obviously, which is much more common, or you yourself have it, and either have taken or have at least heard of the diabetes drug Metformin. Okay, a new study that just came out about Metformin showing significant vitamin deficiencies when you take this medication, particularly in B12. B12 deficiencies, which is a very important vitamin, obviously, for many things, especially nerve health and all this other kind of stuff. So, a new study just came out, analyzed the data of 390 type 2 diabetes patients. They were randomized. They were either given Metformin or they were given placebo. And the group that was given Metformin, they were given insulin during 12 weeks prior, taken off the insulin, and then given Metformin for a total of 52 months. And what they saw was a significant drop, especially in the first few months, in patients' B12 levels. Also in folate levels, just not as significant. And I wanted to talk about this for a few reasons. And if you've seen any of my emails and videos and all this kind of stuff, we're always, in our office especially, we're always looking for, how do we solve the problem? Is there a cause? Is there a root cause here? And can we do something about it as opposed to just taking a medication to fix it or to cover it up? Type 2 diabetes is one of those things, right? I mean, everybody knows, whether they do it or not, that you can get rid of your diabetes, type 2 diabetes, if you are put on a proper dietary program, if you're on a proper exercise program, if you're participating in proper weight management. So here's another case where if you just get the proper counseling, the proper guidance, the proper coaching, you can maintain healthy weight levels, eat a sound, healthy diet, and exercise properly so that you don't get type 2 diabetes in the first place. Okay, so even if you do, those principles are still going to help you to get rid of your diabetes. And taking a medication for it, like this popular medication, is only going to cause more problems, more complications. Okay, study after study. We've known this for a while. This is just the newest study. So, quick recap, right? Type 2 diabetes is exploding in the United States. Okay, it's significantly burdening our healthcare system. Many experts are predicting that it's going to bankrupt our healthcare system in the not too near future. That's number one. Number two, it's completely preventable and reversible with proper diet, nutrition, exercise, and weight management, right? But instead of doing that, because that's a lot of trouble, right? And that takes a lot of time for doctors to do that kind of counseling with their patients, right? So instead of doing that, we give medications like Metformin to treat patients' diabetes, okay? And this leads to B12 deficiencies, which can lead to all other kinds of problems, like neuropathies, which, by the way, is a common complication of diabetes already. So you get diabetes, which can give you neuropathy, so we'll give you the Metformin, which can decrease your B12 and give you neuropathy. Makes a lot of sense, right? Number two, obviously, is if you have lower B12 levels, you're at a higher risk for cardiovascular disease because it can help elevate things like inflammatory markers like homocysteine and et cetera that can cause increased risk for cardiovascular disease. Not to mention that B vitamin deficiencies and the like can also lead to higher risk of degenerative neurological conditions, Parkinson's, Alzheimer's, that kind of stuff. This is just the tip of the iceberg, right? And I know I'm not the only one out there that thinks this is crazy, but this is just a new study I came across. I wanted to share it with everybody. If you're looking for solutions, I mean, these are things we do in our office every day, is help patients with their diet and their lifestyle and their nutrition. So that way we can actually start addressing these issues and stop just giving medications to, number one, cover them up, and a lot of times they don't even do that very well, or cause additional problems. And Metformin's one of them. For a long time we've known this. Here's just another study in a long line. So I hope you enjoyed this information today. If you like it, go ahead, give it a thumbs up. If you know somebody who might need this information, please share it with them. If you're seeing this video, please forward it along on our YouTube channel or what have you. But another incidence where we're creating a bigger problem by trying to fix a problem the wrong way, typically with medications. So hopefully you enjoyed this content. You can always comment below if you have any questions. We'll be here for you, and hope everyone has a great day.